that the State Department of Health in New York underreported COVID-19 deaths in nursing homes by as much as 50%, according to a report released earlier today. The report, well, it holds Governor Cuomo's feet to the fire in a massive way for the way he handled the coronavirus pandemic. He directed nursing homes in New York to accept patients who had or were suspected of having COVID-19. That decision created an onslaught of COVID-19 cases that infected thousands of elderly patients and resulted in hundreds of deaths among the state's most vulnerable population. Now, Cuomo somehow is blaming the Trump administration. I'm baffled by that. More important, it seems, as we try to sort this out and we understand it, every bit as important as Cuomo's policy is Governor DeSantis's policy in Florida at the same time. Because as I understand it, the Florida policy, DeSantis's policy, was directly the opposite. It mandated that nursing homes must not accept COVID-19 infected patients or residents because it would be like the proverbial, wildfire. Would be the worst thing you could do. Now, why don't we see that comparison? I mean, we get it. Cuomo's policy evidently disastrously led to thousands of people dying in New York's nursing homes. What was the Florida policy? How about we start? Listen, what do you do? How do you hold somebody accountable for something like that? How do you hold somebody accountable for sending COVID? And listen, I'm trying to be rational, reasonable. There's no way Andrew Cuomo intentionally sent elderly New Yorkers to their deaths. I'm certainly not saying that. But if a policy like this was so devastatingly, fatal, where's his accountability?